Hey there and welcome. So, if you've ever dealt with knee pain, I bet you've heard this advice. Just take it easy, don't push it, you don't want to wear out your joints. It's a really common fear, right? And it stops so many people with knee osteoarthritis from even moving. But what if that advice, that whole fear, is actually based on a big misunderstanding that's like 50 years old? Okay, let's get into it.
This is the big question, isn't it? Will being active actually speed up the damage and just make everything worse? And, it's a totally valid concern. For decades, a lot of doctors and patients really believed the answer was a definite yes. The fear was that all that repetitive motion could overload the joint and basically chew up your cartilage.
And look, this isn't just some random worry people came up with. This belief is so deep-seated, it comes from decades of very specific advice and some really powerful, but as it turns out, pretty misleading ideas about how our bodies work. So before we jump into the new science, let's figure out where this old story even came from in the first place.
To really get the truth about exercise and your knee health, we have to go back in time a bit and look at where this whole myth started. And the story really kicks off in the early 1970s with some lab research that seemed at the time like a huge deal. So it all started way back in 1971 with these studies on animal cartilage. But here's the catch, and it's a big one. They used extreme, sudden, totally unnatural loads. We're talking things like continuous, high-dose exercise on rabbits and guinea pigs, which, that caused cartilage to break down. And without much more testing on actual humans, this idea that any loading was bad just got fast-tracked into clinical advice. So for 50 years, the go-to advice was basically, don't do much, protect the joint.
And this idea got a huge boost from a really simple metaphor, that osteoarthritis is a wear and tear problem, and your knee is like a broken machine. I mean, it makes sense, right? If a part on your car is worn down, you don't drive it more, you rest it. But here's the thing, that analogy is just wrong. Our bodies aren't machines made of metal and plastic. They're living biological systems that can adapt and even heal. Another thing that really muddied the waters was the words we use. The research points out that we often just lump all these different things together. But the super high-impact exercise from those old animal studies, that's a completely different universe from exercise therapy, which is a custom-built plan of low to moderate movements that a professional gives you to feel and move better. Mixing those two ideas up, well, that created a whole lot of unnecessary fear. So that's the old story. But for the past couple of decades, scientists have been putting this old belief to the test, but this time in actual humans. And all this new evidence, it tells a completely different and honestly a much more hopeful story. And we're not just talking about one or two small studies here, no way. We're talking about systematic reviews, which are basically the gold standard of scientific evidence. Researchers have pulled together the results from dozens of top-quality trials using incredible tools like MRIs and special biomarkers in blood and urine, all to get the clearest possible picture of what exercise therapy really does to our knee cartilage. And the verdict from all of this amazing research is crystal clear. Exercise therapy does not harm your cartilage. It doesn't make it thinner. It doesn't make existing problems worse. It doesn't cause inflammation or trigger those markers for cartilage breakdown. So get this, not only is it safe, but some studies are even suggesting it might improve the actual quality of the cartilage itself. How cool is that? Okay, so if exercise doesn't harm the knee, how on earth could it actually help? Well, the answer lies in a really simple idea. Think about your cartilage not as a car part, but as a living sponge. This is a brilliant way to understand what's really going on inside your knee. So first, a real quick look at what we're talking about. Articular cartilage, that's the smooth, slippery stuff on the ends of your bones. And here is the absolute most critical detail. It has no blood supply. None. It can't get nutrients delivered the way most of your body does. It depends completely on the fluid inside the joint to bring in the good stuff and take out the bad stuff. And this is where that sponge analogy just clicks. Every time you move, every time you put a load through your knee, like when you're walking or doing a squat, you're squeezing that cartilage sponge. You're pushing out all the old fluid filled with waste. Then when you take the load off, the cartilage expands and soaks up fresh, nutrient-rich fluid. This whole cycle of loading and unloading, it's a pump. It's literally how the cartilage breathes and feeds itself. It's what allows the cells in there to repair and maintain the tissue. Movement is what keeps it alive.
Okay, so now that we have this new understanding, we can finally move from being scared to being confident. The evidence is clear. Exercise therapy is not only safe, it's good for you. The real question now is, how do we actually put this awesome knowledge into practice?
Well, the very first step is to have a really good conversation with your doctor or your physical therapist. But let's be honest, sometimes that can be a little intimidating. The research actually suggests a super simple 3-step framework you can use to guide that chat and make sure you and your clinician are totally on the same page.
It starts with just assessing the situation. Simply ask them, are you worried that exercise could hurt my knee cartilage? That question just opens the door. From there, you can address any old beliefs, you can share what you've learned, hey, maybe even mention the sponge analogy, and talk about the difference between that normal muscle soreness you get from a new activity versus actual harm. And finally, you promote a new plan together. The goal is to create a gradual, personalized program that helps you feel better and that you can actually stick with.
And you have to remember the benefits here are huge, and they go way, way beyond just your knee. The research highlights that exercise is basically medicine for at least 26 different chronic conditions, and a lot of those are super common in people with osteoarthritis. We're talking about things like lower blood pressure, a better mood, even better brain function, all with a super low risk of side effects compared to a lot of other treatments. So, we'll end with this question. After 50 years of a myth that led to fear and people not moving, the science is now clear. The right kind of loading doesn't wear your knee down. It actually nourishes it. Exercise therapy is a first-line evidence-backed treatment for knee osteoarthritis. So if exercise is medicine, are you getting your prescription? Thanks for tuning in.